Okay, I'm with Russell Razzaque, and I'm hoping I'm pronouncing your name correctly, Russell.
It's Razzaque, as if it's
Raz
a key on the end. Yeah,
Razzaque, thank you so much.
okay.
So you are in London, as far as I know, and I am in Vermont. And please introduce yourself to us. Tell us a little bit about what you're doing right now in London, and let's learn a little bit more about Russell.
Okay. So, yeah, I'm a psychiatrist. I work in East London. I've been working in adult mental health for nearly 20 years now. I've had my own mindfulness practice for the last 10 years, and I've been researching it for a lot of that time.
Mm.
In the last couple of years, I've been teaching mindfulness too, and incorporating it into my work gradually over time. And my own practice, I guess, has led to a bit of a shift in me in terms of understanding mental health and understanding how we relate to the people we look after. And I guess that through finding deeper ways to relate to myself, I think I've managed to find deeper ways to connect to the people that I'm working with. And that has led to quite a few kind of revelations in terms of seeing things beyond the kind of labels and the sort of normal classifications that we tend to use, and also learning about and just experiencing the value of being present with pain and with turmoil and with difficulty by learning to do that in myself first. So I've kind of gone through a bit of a journey really from the traditional kind of Western education in psychiatry to utilizing methods such as mindfulness that have taught me to connect to others through myself
And
rather than textbooks and things.
yes, and I've just heard by the grapevine that you're teaching mindfulness to other physicians and doing retreats, as well as teaching it to some of your clients. Is that correct?
Yes, that's right. I mean, I started teaching it to some of the clients in group work and other things, but it became increasingly clear that with the literature out there on mindfulness, there is actually a supply deficit in that there's a lot of demand for it now, but not as many people who can actually teach it. And the truth is that unless you can establish your own mindfulness practice, you're not really a great person to teach it. I mean, I wouldn't learn to drive a car from someone who can't drive a car, you know? So,
Yes.
so the idea was to help some physicians to actually develop their own practice, and really the thing that really helped me was going on retreats, actually immersing yourself into it,
Mm.
and then as you come out of it, you can establish your own daily practice. So I've run a few retreats like that, and a lot of these guys, from a third to nearly a half, have a 3 or 4 months later, after we did some audits, have still had their own practice every single day.
That's
So that's made a
fabulous.
big, yeah, yeah,
Yeah.
very
So,
exciting.
Russell, I'm very excited to get into this in more depth. And why don't we stop our introduction at this point? And I want to say thank you for this brief introduction. And in a moment, I'll come back to you and we'll do a longer talk. Okay?
Okay,
Thank,
thank you.
thank you so much.